Hello class, my name is Maria Pena, and today in Human Sexuality we will be discussing 4 different sexual dysfunctions. I will define them, tell you their causes, and a few things you can do to treat them. First, I will begin with female orgasmic dysfunction, and what this is when a woman cannot reach orgasm or is having trouble reaching orgasm when she is sexually excited. When sex is not enjoyable, it can become a chore instead of a satisfying, intimate experience between two partners. Sexual desire will often decline and the sex will occur less often. This can create conflict and resentment in the relationship. And to give you guys a visual of what this could look like, here's a couple. See, they're experiencing some difficulties. Causes of female orgasmic dysfunction. There are many factors that can lead to this. I'll go ahead and list a few. It could be because of a history of sexual abuse or rape, boredom in sexual activity, just negative attitudes towards sex in general that have been learned through childhood, or even just shyness or embarrassment to ask for the type of stimulation that really works best. And important goals when treating problems with orgasms are having a healthy attitude towards sex and just education about sex in general. You should first start with thinking about how to make sex better overall. Just have plenty of rest and eat well. Do Kegel exercises to really tighten those muscles. They also recommend sex counseling to learn series for couples and the exercises that they can do together. They need to learn and practice communication, and they need to learn more effective stimulation and playfulness. And also a treatment for this, taking female hormonal supplements. The treatment is unproven, but and the long-term risks remain unclear. Secondly, I'm going to move on to male orgasmic dysfunction. This is very similar to female. The definition is a persistent or reoccurrent inability to achieve orgasm despite lengthy sexual contact or while participating in sexual intercourse. This can also be very frustrating for the man. I couldn't even imagine. Here is a picture of a couple experiencing this issue. Very frustrated and distraught, you could see. Causes that can lead to this. They could be organic, meaning it could be related to the condition in the body, but in most cases it is psychological. First, organic causes could be thyroid disorders, pituitary conditions, diseases that affect the nervous system, and then if it's psychological, it could be either intrinsic or extrinsic. An intrinsic factor would be depression or a feeling of guilt. Or if it's extrinsic, it could be an unsatisfactory relationship with a partner. Treatments for this, if it is extrinsic, they recommend just getting completely rid of whatever it is that's worrying you. And in the majority of cases, psychotherapy will be suggested. The treatment, in any case, always requires the support of the partner to make it more comfortable for both, because takes two to make the relationship work. Thirdly, I will be discussing premature ejaculation. What this is when a man has an orgasm sooner during intercourse than desired. This is actually quite common. What I did was I printed out a stat of how many men have it, and if you could see here, 9 out of 10 men ejaculate within 1 minute. And that is a lot faster than a lot of guys would like to admit. It's a very common complaint, only rarely caused by a physical problem. And treatment for this, what they recommend is practice and relaxation. Or the stop and start method, which is sexually stimulating a man until he's about to reach orgasm, stop for 30 seconds, and then go again. And lastly, I will touch a little bit on retrograde ejaculation. And what this is, occurs when semen enters the bladder instead of going out through the urethra, during ejaculation. The causes, this is a very uncommon dysfunction. It is caused from maybe diabetes, some meds used to treat high blood pressure, and surgery to treat prostate or urethra problems. And treatments that they recommend to fix the situation is go see your doctor and have them kind of diagnose you, and usually just requires you to get off of your certain medication. And I went ahead and printed out a diagram of it, and you could see here, see the semen is going up into the bladder as opposed to down the urethra. That's what it will look like, and it will cause clouding. And thank you so much for listening today. That about wraps it up. I hope you enjoyed my presentation. Thank you.